Well, and we start with the current slide. And here we are. And so we read the article about concordance. Now let us summarize what we do remember about this article and the ideas which were expressed there. So there are 7 questions here on the article, and let us listen to Rohit. Are you here? No, Rohit?
Yes, ma'am.
Yes, Rohit, please, the first question.
What features of new medicine should make people take medicine prescribed to them?
So,
Um,
features of new medicines. So the information was here in this part.
comprehensive with non-standing problems, fatigue, cancer. This is strong. Which have just like less side effect, ma'am.
And convenience of use.
Yes, ma'am.
Okay, good. So the next question is for Ritik. Ritik, are you here?
Yes, ma'am. Which medicine are least likely to be taken by patients? Old medicines are likely to be least taken by patient because it have many side effects, as well as they are more um, more greater.
Okay, and
Have
especially
more greater amount of these materials, which is complicated in taking the medicines.
and so one group of medicines are most unlikely to be taken as prescribed, which is medications for preventive purposes, right? So that
Yes, ma'am.
that they do not see any effect in using them. Okay, so the next question is for Mohammed, please.
Yes, ma'am. Which group is more likely to not to take medicine prescribed because they do not believe the illness is there? Ma'am, the people.
What about question number? Oh, sorry.
Question number 3.
You're right. Yeah.
Yeah, ma'am. Yeah, ma'am. Ma'am, the younger, like child and the old age peoples are not like take medicine.
Okay. Yes, because why?
Ma'am, because they thought that there is no illness there, and like that, and like ma'am, the children's basically don't like medicines.
I see. Okay.
Yeah, ma'am.
Well, now Aman, please, the next question.
Yes, ma'am. Besides providing information, what effective ways can improve the compliance? Besides providing the information, we can ask people to like contribute as by understanding the basic needs, and also the by advertising, and there are many programs, self-management programs.
Yes. Okay.
And yes, ma'am.
Yes, they can help in this situation. Well, Apeksha.
Yes, ma'am. What is more important? No, which one was that? What do patients need to be helped to make? The patients need to be helped to make informed choices about their treatments.
And what is more important than increasing compliance?
Oh, sorry, I skipped the question. What
Yes.
is more important than increasing the compliance in a patient? Meeting patients' individual needs and priorities.
Okay, good. Now the last question, number 7, is for Misha, please.
What can be of help to both the individual and the general population? General awareness and improvements in, like, we have to understand that taking medicines is important, and medicines are cost effective, so they don't have to pay much also,
Okay.
and they have to complete their course of medicine. Awareness.
Okay, so I think this is rather useful information in your future practice, just to remember and to understand the situation. And so there's a picture, a humorous picture. There is a cartoon about side effects of here AstraZeneca. And as you see, the doctor says sees some just evidence of side effects after this medication: shortness of breath, chills, and sweating and trembling. But the nurse says that she hasn't injected him the medicine yet. Okay. Well, and so now let us focus on some language aspect here, and we'll speak about the use of modal verbs can and may. So so when we speak about drug or medicine that cause side effects in some people, it is important to understand the difference in the use of can and may. So as you see, they mean they can express possibility in this context, and they are very close in the meaning. Can is used to express a theoretical possibility, and may is used to express a real possibility. So we can understand it looking at the examples which are presented here on this slide. The first one is with can. The sentences are similar. The door can be locked. It means that it is possible to lock the door. Right now, it is either locked or unlocked. We don't care. So there is a theoretical possibility of locking the door, right? And if the sentence is used with the modal may, it has different meaning. The door may be locked. It means it is possible that the door is locked right now. And if it is locked, we won't be able to open it. This is like when people are approaching to the door and they can say this phrase. So, and so can is used to say that a side effect, for example, is possible. In this sentence, this medication can cause some stomach irritation. It means it is possible for this medication to cause some stomach irritation. Can indicates possibility. To reassure parents, you can emphasize that the side effect is theoretically possible, but not of serious concern to the patient you are talking to. So it's not serious concern, yes. You should just say that you mean that this occasionally causes stomach irritation in some people, or sometimes people get stomach irritation with this, but it isn't usually a problem. So when you use can, you emphasize this situation. But if you use may, which also expresses a side effect, that the idea that a side effect is possible. So in this sentence, this medication may cause some stomach irritation. It means it is possible that medication will cause some stomach irritation. May indicates the possibility of the statement being or becoming true. And the word may in this sense is frequently stressed and indicates that the stomach irritation is a strong possibility. Not like with can, it's very low possibility, but here is a strong possibility. You may want to emphasize this. It has the same meaning as there's a strong possibility that this will happen with your stomach. Just percentage is very high. So this is the main difference in the use of can and may. So the possibility expressed with may is stronger. And now let us have a look at the exercise which is given on this slide. And as you see, we are going to use the words which are given in the box: possibility, may, will, can, probably, may not, instead of the gaps in the sentences. Let us look at the first sentence and listen to Priyesh. So what would you use in the first sentence?
In some people, it can cause a fleeting headache, but it doesn't mean you will get one.
You will get one, yes. Mhm. Okay, so please look at the other sentences. I'll give you, let us say, 3 minutes to write them and complete the gaps with the words from the box. Okay, start, please.
Done.
Done.
Done, ma'am.
I see. Just wait a little bit. Well, let's check what we've written. Who was the last to speak? Priyesh, yes? Rakhav is absent. To Joel, please.
Yes, ma'am. Theoretically, this can cause low blood pressure, but you probably won't have a problem.
Mhm. Probably. Does everyone agree?
Yes, ma'am.
Mhm. So
Yes.
you probably won't have. That is why can is used here in this sentence. Okay, after Joel, Sayonika, is she here?
Yes, ma'am.
Sayonika? No. Rohit?
Yes, ma'am. Some people get blurred vision, but it happens, ma'am, may not. Some people get blurred, but it may not happen in your case.
Okay, yes, you're right. Well, Ritik, please.
Yes, ma'am. There is strong possibility that this will upset your stomach. In fact, it may make you feel really ill.
Yes, strong possibility. That is why in the second sentence, may is used. It may
Yes.
make you feel, because the possibility is strong. Okay, Mohammed, please.
Swelling of ankle is not common, but it is possible. It can happen.
It can happen. Good.
Yeah.
And the last sentence for Aman.
This can make you feel dizzy, so you should be careful when you drive. Can.
Ma'am, may.
You should
May.
be.
May.
May.
It should be may, because
Because it is a strong
the doctor
possibility,
says
ma'am.
that you will probably feel dizzy, right? You should be careful. So may should be used here in this sentence because the possibility is stronger. Okay, this is the way we use some modals and other words in the meaning of possibility, and you are given the home task to do some exercise with modals, and be careful with the deadline. As far as this is the final week of midterm 2, I need some time just to calculate your points and just upload the information on the Univer site, upload your points. That is why the deadline for the home task will be Friday, not Saturday. Okay, so please.
Ma'am, we have to do that written or in the word form, the grammar work homework of
The
today?
grammar. So the instructions are on Moodle site. It should be written in. You should handwrite this on paper and then just
Okay, ma'am.
make the screen or the picture of what you have written and just upload this information in PDF file as we usually do. Okay. So the deadline is Friday. And so I would like you to have a look at one more task. So, and just write about some benefits and side effects of the sedative diazepam. We started speaking about diazepam just last class. It belongs, as it's shown here, to sedative or hypnotic, just a group of drugs. And so please write some sentences, and you may start with the beginnings of, you may start your sentences with the words which are given here on this slide. In some cases, the tablets can, there are some people, theoretically it can cause. And please use the phrases like can, probably, will, may,
How long?
other
Ma'am,
words.
how long should we write? Ma'am, how long should we write?
Just
this?
about, let's say 5 sentences, maybe. So it depends on how well you know this drug diazepam and how well
And
you
ma'am,
know.
should we write electronically or on paper?
No.
Right.
So just a couple of minutes for you to write the sentences now, and then we'll discuss. Okay. Just
Okay.
let us say 3 minutes. So just take your time to like write the sentences about diazepam. Hello, Sayonika. Vandana.
Yes, ma'am.
Good morning, ma'am. I'm sorry about joining late, but I was traveling. I hope you understand.
So you can see the task. Please write the sentences about
Yes,
side
ma'am.
effects.
Write the sentence about the benefits and side effects of sedative diazepam using.
Yes.
In some cases, the tablets can. There are some people. Theoretically, this can cause. Okay. We have to complete the sentences.
Just a couple of minutes for you to write the sentences. Okay.
Ma'am, can I type? Because
Just a minute.
traveling,
Just a minute. Just write the sentences now.
Okay, ma'am.
Well, shall we start? Who would like to read the sentences? Maybe we can listen to the students who have just joined us. Sayunika, are you ready?
Yes, ma'am.
So please.
Write sentence about the benefits and the side effects of these sedatives. Diazepam, using in some cases the tablets can. Some people, there are some people theoretically this
Have you
can
written
cause...
anything, Sayunika?
Yes, ma'am.
What have you written?
Question. In some cases, the tablet can treat anxiety, alcohol withdrawal, and seizures. And some people who are addictive to diazepam may get withdrawal symptom when they withdraw.
Okay.
There are some people who feel drowsiness and fatigue and muscle ache. And theoretically, this can cause drug addiction in some people, hallucination.
Even hallucination. Okay, so thank you. So can we add, so Priyesh, what can you add to this?
Ma'am, can I'll just go with the side effects, ma'am. The side effect of diazepam drug, in some cases, it may cause drowsiness, dizziness, tiredness, muscle weakness, headache, and dry mouth. Some people may experience nausea and constipation as well. Also, there are some people who experience physical dependency, in which unpleasant physical conditions occur if medication is stopped or taken in smaller quantities. Theoretically, this can cause a burning or prickling of hand and feet, etc., and hallucinations. Thoughts of self-harm and overexcitement or loss of touch can also be experienced.
Okay, so good, thank you. So does anyone have other ideas about side effects? Different ideas or the same?
Not exactly the side effects, but I think so. In some cases, the tablets can, and in some people, if the word is used, then we can't use may now. We should use can. I got confused for that.
So if the possible, of course, they are interchangeable, but so if you would like to emphasize that it's possible, you should use may, yes? But if you just want to reassure the patient, you say can, yes, this is the difference. Okay, so, and we agreed that we are going to listen to whom? Ritika and Rohit, right?
Yes, ma'am. We have prepared on ERCP topic.
Okay, so let's listen to you. And I mean that, yes. Okay, so I give you just, you can show your presentation now. Hmm? Yes, Ritik.
Ma'am, is it visible?
Yes.
Yes, yes.
Yes, ma'am. Ma'am, ECR. First of all, ma'am, this is made by ma'am Rohit and Ritik, my group mate. And ma'am, this is topic about ECRP, ma'am, which is known as endoscopic retrograde clogenic pancreatography. Ma'am, I will talk in short and very basic. Ma'am, it is a device which is also called endoscopy. Ma'am, it is in the top of them there is a camera. Ma'am, it is to check inside our stomach area. Ma'am, it is a pipe which is transferred through our mouth. One minute. Yes, ma'am. It is a ma'am basically ma'am non-surgical. There is no surgical cut or anything. Ma'am, it is a procedure to examine the personal digestive tract like stomach or esophagus. And ma'am, endoscope is the device which is attached to a light. It is used to look inside the body and our cavity. Ma'am, cholangiopancreatography is the study of biliary pancreatic duct system. Endoscope retrograde colonography or ERCP is a procedure to diagnose and treat problem in the liver and gallbladder, as I all said. And now, what might I need ECRP? Why do I need ECRP? Ma'am, sometimes, ma'am, we cannot predict what is happening inside our body. We cannot predict the problem. So that's why we do ECRP to find out the unexplained cause in our abdomen pain. Other thing we found in ECRP, which include which also finds any type of blockage in our bile ducts, any type of fuel leakage in our pancreatic duct or anything, and tumors, various things like infection in bile ducts, etc. Now, third thing, what are the risks and complications in the ECRP? And there are various risks in ECRP, just like first of all, in some pregnant women, if someone having any type of problem, they could tell the healthcare provider. And then secondly, it is very essential to tell the doctor, ma'am, if you are any allergic to any sensitive to any medicine or any dyes, etc. And then there is condition if you are available or you are able to have ECRP. If you had a gastrointestinal surgery that is blocked the ducts or a biliary tree, or you have pouches in your esophagus and other abdominal anatomy, that makes it difficult to perform. Now, second, how do you get ready for ECRP?
Yes, ma'am. How do we get ready for ECRP? In which the patient, it is done by the specialist doctor or we can say surgeon. In this ECRP, there is special diet before the procedure, and do not drink. We have not to drink liquids, and special diet is given 1 or 2 days before the procedure. And it should not be taken when the patient is pregnant or some patient have some heart disease, and there is some sedative is also given which may awake the patient during the procedure, because it is a complex procedure, and should if we lose our strength, so it cannot be able to test during the procedure. And your healthcare provider also provide a consent on this, that you have done or not. And we have not to drink the fluids, etc. And there is the doctor ask about the history of bleeding disorders if you have, and any medicines which are taking about, which are essential in the procedure. Next slide, please. Next slide is happened about what happens during ECRP. Ma'am, during ECRP, and intravenous line should be put in our arm and hand, and it be over through the mouth guard and put from mouth and done through small intestine, and the small tube pass through this, and the X-ray of our internal views will be taken. And there are some X-ray in which a biliary tree are taken, in which a small tube is injected and to the pancreatic duct, and the pancreatic duct and X-ray of pancreatic duct and small intestine will be taken. And you have needed to provide a sample of fluids and removal of gallstone or other blockage which are in the endoscope, which are needed in the endoscope. And about what happens after ECRP, there should be check of the blood pressure, breathing, and stable, which have high alert in the hospital room or discharge room. And you are not allowed to drink any about the few days, and you may have a throat throat and pain in the few days, and it's normal thing. We do not have fear about that. And many times there is a rectal suppository, a certain medicine that is rectal suppository is given to the patient of which have ECRP to reduce the risk of pancreatitis, because inflammation in pancreatitis can be also given. And if any risk is happen, we have to tell to healthcare provider or anything. And we also can provide abdominal pain, nausea, or vomiting after the ECRP. It's normal. And there is a blood stool is also happened during the procedure. Thank you, ma'am.
Okay, is it all?
Yes, ma'am.
Thank you. So do we have any questions to the speakers about this procedure? No questions. Okay. Well, you can stop demonstration of yes. Okay. Thank you, guys. And there is one more group left. So Nivas and Vandana.
Yes, ma'am.
Unfortunately, so there is only 3 minutes left. Remind me next class. We'll start next class with your presentation, okay?
Okay, ma'am, no problem.
So, and I should also say several words about the test that we're going now to take.